Hello, everybody. Welcome. Better Spaces is a health and happiness solution for today's hybrid workplace. My name is Dr. Paul Cachola with PAR5 Physical Therapy here in Randolph, New Jersey, and I've partnered with them to bring you an easy and educational workday session. Today's session is back pain self-treatment tips. A little bit about me. I'm a physical therapist. I got my doctorate in 2010. I'm a orthopedic clinical specialist, a certified golf medical professional, and certified dry needling specialist. And I've opened my practice here in 2019 in Randolph, New Jersey, so I could help active adults get back to doing the things that they love to do without pain meds, injections, or surgery, even if you've tried physical therapy before. So let's pull up our slides here and let's get into it. Back pain self-treatment tips. Now, because I'm a medical professional, I have to say this disclaimer at every one of my talks here. If you're dealing with pain, this is general information that's targeted at a broad population. It's useful information, but be aware if you're going to need a customized assessment and thorough physical exam and treatment plan to successfully treat all the components of the root cause of your specific dysfunction. So anyway, I always tell people this. They say, all right, it hurts right here. This is my back. It hurts right there. I got like an MRI that tells me that I've got this herniated disc, such and such. But you know what? I tell them that the source of your back pain isn't always the cause. There's so much research, so much studies that show that the findings of X-rays and MRIs are not correlated 100% to pain and dysfunction. You could have a small herniation and have a lot of pain, or have large herniations, have no pain at all. I had this one guy that came in who he was a shoulder patient, maybe like about 10 years ago. And on the MRI, it said he had a full tear of his rotator cuff tendon. And when he came in to see me, I expected a lot of dysfunction, a lot of limited range of motion, but he came in and started flinging his arms around. It was like, it's fine, it's fine. I'm like, wow, that's great. I don't know what you're presenting is not what I'm seeing on paper. So pain and injury, you know, and MRI findings, they don't always correspond one-to-one. All right, so just real quick, let's just kind of go over what is the spine. You know, it's basically joints, right? It's a resilient structure. The vertebrae, the joints are the facets, we call them. And the disc is this kind of like jelly donut. It's got a hard outer covering and this aqueous inner center that kind of, it's like a gimbal. It kind of allows our joints, our bones to move and absorb shock. And then we have nerves like the spinal cord that passes down the middle, and then nerves that go out to the side. And then everything is held together by this lattice work of muscles and fascia. Fascia is connective tissue. Muscle without fascia is basically hamburger meat. If you've ever seen hamburger meat, that's muscle, but it doesn't have the fascia because we cook it. Anyway, cervical spine, we have cervical, thoracic, and lumbar. These are the three parts of the spine. It has curves. Curves withstand force better than straight lines. So once we start to lose these curves or they become excessive, that's when things get to be a problem. So 3 common causes of back pain. You know, muscle spasm, is it tight? Is it weak or something kind of like not functioning well? You know, stretching may help, it may not help. When a muscle might feel tight, it might just be on too much. It doesn't turn off. And then you get this feeling like, oh yeah, this feels tight, mainly because it's compensating for another part that's weak or not functioning well. And it's acting as its support structure. It doesn't turn off and on properly. So things might feel tight, but not necessarily be short. Joint dysfunction, you know, facet joints in the spine are like the shingles on a roof. So when you flex forward, the shingles move forward, they open up, and then when you extend backwards, they close. So inflammation, arthritis, degenerative changes, that could all affect how those joints move. And you know, when we're young, these joint surfaces are smooth. They're lined with nice, healthy cartilage. But as we age, anyone over the age of 40 is going to have some type of finding of arthritis on an X-ray and MRI, right? That's guaranteed because we live on Earth. It has gravity and the stress of life and the forces that we put on our spine accumulate over time. So, you know, it's very common that people have a joint problem, but again, doesn't necessarily relate to function, dysfunction or pain. The other one is a disc pathology or something like, like I mentioned earlier, the disc is like a gimbal, it allows for movement and absorb shock, but sometimes there could be a bulge or a herniation or an impingement or something that can affect movement and cause associated factors in the surrounding joints or muscle tissue to kind of compensate for that. So, it's like pain is very complex. It's comprised of a physical reaction, neurological, psychological, and social or situational. It can occur, you can have pain in the complete absence of any tissue trauma or damage, right? Pain is just an output. It's a signal from the brain, right? The electrical signals that come out of our brain that say there's something wrong, we have to kind of, deal with that and interpret that. Oftentimes people come to see me with chronic issues. I have had, this one guy came in, he had back pain for over 20 years. And I said, all right, well, what happened? Well, 10 years ago, I went to a doctor, I got an MRI, they showed me this and whatever. And then it never got fixed. I'm always having back pain. Well, you know what? He was always treating the back. And then we kind of miss a lot of these associated factors that are perseverating the issues in his back. We have a sensitivity dial in our brain that alerts us to threat or pain, right? The one analogy that I give people is like, if you're relaxed on vacation, sitting in a beach chair, and your hand is in the sand, and you can just close your eyes and hear all the waves crashing, you're totally relaxed. You're not at any level of threat. That's how our brain functions when we're relaxed in the parasympathetic mode, the rest and digest. On the other side, we have, if you were walking down a dark alley and you couldn't see very well, but you hear people in the dark in the corners and you're frightened, your brain is on high alert. That is the sympathetic side, the fight or flight. Oftentimes with chronic pain, your brain spends way too much time in the sympathetic side and not enough time in the parasympathetic side. So then your sensitivity to stimulus and interpreting outside stimulus as pain gets heightened. Like, all right, what used to not be nothing, I'm just gonna throw that out. And then like, yeah, I feel this little ache or whatever. With a heightened sympathetic nervous system response, we have like, oh yeah, that little thing that's like, oh, it hurts, I don't want to move, and then all kinds of things can happen from that. So treatment is often addressed at treating the pain, and if we only treat the pain, then we just get the temporary relief, we feel good, but then the pain comes back. And there's many different ways to treat back pain. We have like massage, you have chiropractic care, you have physical therapy, you have surgery. No one treatment is the complete answer. Medical knowledge, it changes. It changes and modifies every 5 to 7 years based on research. It comes out and then it's like, all right, now we know something new about pain, the back, and it changes how we treat. So, but historically, the patterns show that passive modalities are less effective than active modalities. What does that mean? If you're lying on a table and getting something done to you, whether it be electrical stimulation, ultrasound, or just massage, those are passive. You're not doing anything. They're less effective at addressing the complete root cause of pain than active modalities. Active modalities are exercise, stretching, things that you're doing. We need a combination of addressing the neural causes, the nerve issues, the central nervous system of pain, and the mechanical causes, whether it be flexibility, strength, stability, stuff like that. Pain is a fluid experience, right? It's influenced by many factors, like I mentioned, stress, hydration, fatigue, environment, your beliefs, your previous history of pain, and your emotional state. When you're happy, you feel less pain. When you go on vacation, yeah, my knee never bothered me when I went on vacation. Or when you come back, you're back at work, you're sitting at a desk, and like all of a sudden now I have all these pains. When you're stressed, sad, or upset, you'll feel more pain, and it kind of feeds into each other. So the one of the tips to address pain is answering this question. So what day-to-day activities make it feel worse? And this can help drive the treatment plan. And on the other hand, what day-to-day activities, what positions make it feel better? And once we piece that together, we can develop a pattern where you prefer this and don't like this, and then we do this thing that makes it feel better, and that's how you heal and treat your back pain. We'll go over that in a second. You know, we just learned about activities, and we learned what positions and postures that our body adapts to, because the more positions or the longer we spend in a certain position, our body just adapts to it. And we develop what's called a directional preference. Like one position feels better, and then another position or movement feels worse. And we kind of look at directional or movement restrictions, right? We're tight in this direction because we never go into that direction or that position. And then when we try and get into it, it hurts. So the body functions, if you've ever been to one of my other talks here, the body functions on this alternating pattern of stability and mobility. If this pattern is disrupted, pain or injury is a result. If you remember anything from my classes, remember this one thing. This is the alternating joint by joint approach that really is effective at treating back pain. So if you look at the back, the lower back, particularly what we're talking about, that is supposed to be a stable segment. If the thoracic spine, the T-spine, or the hips are not mobile like they're supposed to be, then the lower back reverses its role, because your lost motion here, your body's like, all right, I need to gain that motion back. So then it makes the back an unstable segment. It makes your lower back more mobile. And that's not what we want. Okay. So everybody should be able to perform certain maintenance on your own body. All right. So that you can maintain it and it can function for years to come. I never want anyone to rely on me or other people to do simple things that you can do for yourself. But on the other hand, you should always know when to seek a specialist help. So for example, if you have a car, you know which side your gas tank is on when you drive into the gas station. Or you may also know how to change the oil or change the wipers. Those are simple maintenance that you can perform on your own. But if the transmission or the electronics fall apart, then you need to go to the mechanic and have that fixed. Same thing for your body. So we're going to go over some half kneeling hip flexor stretches and stuff. You know, there's a video here of doing that. We're just going to talk about that. I'm going to show you that in a second. We have a cat, camel, child's pose, right? These are positions and movements that we borrowed from yoga, and then soft self-trigger point releases. These are things that you can do on your own if you do have a flare-up. Now, I'm trying to go fast for these exercises because and videos, because I'm going to show you them in a second. But your body knows movement, it doesn't know muscle. So keys are really to train positions, and if you try to target a muscle, make sure that you feel it in the right area. Oftentimes our body will compensate and use stronger muscles to mask the weak ones and then build or perseverate or facilitate this poor movement pattern and this movement dysfunction. All right, and then the last thing that I want to cover is how to control your core. The transverse abdominis is the key to prevent your back pain from coming back, and also the glutes. All right, so this is the picture of all the abdominals. We have 4 different layers. The rectus abdominis is the first most prominent layer. That's that 6-pack that goes up and down. Then you have the internal and external obliques. And then you have the deepest one, which is the transverse abdominis. This is one that we're going to be talking about and activating in a second. That wraps around like a girdle. It's like if you've seen back braces or whatever with the Velcro, you just kind of strap around like, oh, my back feels so much better when I wear that. That brace is an artificial replacement for the transverse abdominis. People with chronic back issues usually have no control or no ability to activate that muscle without activating all the other ones. You should have complete control of your body, be able to activate one muscle and not the other. And then the transverse abdominis usually is the weaker one that gets inhibited. And then if you don't have a good brain to muscle connection, then there is a lack of stability for your lower back. And then we have the back pain. All right, so we're going to check your core in a moment. Let's see. All right, so let's get into this. I'm going to turn off my little clicker, and then we're going to get into it. This is the active participation section of our talk today. So number one, you're going to get out of your chair, and actually, let me grab a ball here, because when we do have, let's start from the beginning. Let's just say you have back pain. You're like, all right, how am I going to fix this? We talked about directional preference, right? So that's our first thing. What positions make the back worse? What positions make the back better? So we could kind of divide it into 2 different directions. Keep it simple. Bending forward or going backwards, extension. So that's flexion, we call that. And extension, going backwards. So sitting is characterized as a flexion position, right? You're flexed. Standing and walking is an extension position. So, that are two different positions, sitting or standing and walking. So you think, all right, which one makes my back feel better? If sitting makes it feel better, then that's a flexion preference. If I like walking and standing, then that makes it a extension preference. Now, that doesn't take into account prolonged sitting or prolonged standing. That's a completely different thing. So if you can sit okay for 5 minutes or 2 minutes, but then prolonged sitting and then makes it worse, then that's a different story. And that's also different than sitting and then after a while standing up. That's reversing the position, going from a flex position to extended position. That's a different category. But if we just boil it down to, all right, can you stand or sit? Which one do you like? That kind of gives us an idea. Furthermore, we could start on your back, all right? And then let's see if I can go on the camera here. There we go. We're gonna start on your back and we're gonna test out flexion. So if we feel out how your back is in standing or sitting, it doesn't matter, and assess how that feels, that's the baseline. And if you want to give it a number in terms of intensity, that's typically what I do in the clinic. We pick a number of how your back is. 0 is no pain, and 10 is extreme amount of pain, the most pain you've ever felt. So whatever the number that is, that's our baseline. Now we're just gonna pull the knees into the chest. Now this is our movement test, right? So I'm gonna use my hands as much as possible. I'm flexing the hip and I get the back to round out as well as I do this. So if I do this 10 times, and I say, all right, does it hurt when I'm moving? Does it hurt at the end range? And after 10, does my back feel worse, right? So that kind of drives that. If it is worse, then flexion might not be your directional preference. If it feels a little bit better, but it still hurts, then that means that we just need to increase the dosage and the time that you're in flex position, because movement treatment is like medication. If 5 milligrams work, but doesn't get rid of the problem completely, you might need 550 milligrams or 100 milligrams. So that means that we just need more reps, more time in that flex position if you feel a difference. Now, extension, going backwards, we're gonna go onto your stomach. And then we see, all right, what does the back feel like now? I'm gonna keep my hips relaxed, my legs relaxed, and I'm gonna do an extension. Now, we could start off from the elbows and just see what that feels like. Hopefully I'm on the camera, good. You can see me here, extending the spine. I'm using my arms to get my back to extend. And I do that maybe like 10 times and see, all right, what does that feel like? Does that hurt the spine? Can I get into this position? Is there pain during motion? Or is it worse after 10, all right? And then if you can tolerate that, I prefer having to do extension with the arms or extending the elbows all the way, because that's a bigger range of motion. And that will give us a better, more information if you really prefer this direction. So if I'm going to do some extensions here, I'm going to do 10. And then after I'm done, I'm going to assess how my back is. If it's better, again, or worse, that gives us an idea of whether or not we prefer that position or that direction, okay? And then if we have, as an aside here, a trigger point or a tight area in the spine, I brought this lacrosse ball out. You could use like a tennis ball or a baseball, it doesn't matter. But our borders here are going to be like above the pelvis, not onto the spine, so we're to the side of the spine, and below the ribs. So this little square rectangular area, that's where you're going to put that ball, and you're going to lie on top of it. So this is one way to address tight tissue. Now, if there is a trigger point in my lower back muscles, the first thing that's going to happen is that it's not going to be comfortable when you apply pressure with the ball. So you're going to get into that sympathetic nervous system response, fight or flight. We have to combat that and reduce that reaction by working on our breathing. Breathing through the belly, expanding through the belly through 360 degrees, not just up to the ceiling, but out to the side, and into the back, into the floor. Taking deep breaths in and long exhales, all in and out through the nose. A minute and a half of deep breathing exercises with the ball on that trigger point will reduce that sympathetic nervous system response and get you into that parasympathetic nervous system response so that the muscle can release under that ball. Once we're calm and we're good and it doesn't feel as bad and we've calmed down our nervous system response, we can start to move our leg And then that creates more movement of the tissue over the ball and restores that sliding and stretching of that muscle, right? So we want that muscle to be able to lengthen, shorten, contract, relax, and then we could do a knee to bend position that increases the loading or stretching on that muscle in my back. So this is how you release a trigger point in your back. And it usually takes about 1.5 minutes to 2 minutes. If you have an acute trigger point and you cannot tolerate this, do this in bed on a softer surface or use a softer ball, but it will take time for your body to release and relax into that and allow that thing to have its effect. All right. So once we're into that, we talked about directional preference, the trigger point release. Now we could also work on just general stretching, getting into positions where if I don't have a directional preference, my back is worse in either way or whatever, then we can start to just go into mid-range flexion and extension, or bending and extending. So I get on my hands and knees here. I've got my hands below my shoulders, my knees below my hips, and I just kind of go through this mid-range cat camel. This is something that you can do in yoga. It's just flexing or extending my spine and then flexing the spine. You can see that I'm not really pushing through the shoulders. I'm really focusing on my pelvis and my lower back, my abdominals here. As I come up here, I'm activating my abdominals, rounding out my back. My pelvis rotates backwards. And then when I let everything sag, I activate the muscles in my lower back. My pelvis tilts forward. My belly goes to the floor. So, about 1.5 minutes of doing this, right? Cat camels. If you're good with this, this helps to loosen it up. Then we can go into like a child's pose where you rock the hips down and back, flexion, bending of the spine, head on the ground, hands going forward. That's a big flexion stretch. And then gradually transition into the extension position. So I walk my hands, reposition my hands forward, and then drop the hips into the floor. So we can think about breathing, deep breathing at every position here. I'm gonna gently go back into that full flex position, take 2 or 3 deep breaths in this position, allow my back to relax, and then do the repeat into extension, into the cobra, just kind of breathing, exhaling, long exhales, letting my back relax into this position. So this is how we restore normal flexion and extension through the spine, the 2 directions. Once we kind of figure out that we can address it with the repeated extension going in one direction. Remember, we can't do that cat camel or the child's pose to cobra unless we know first which direction you prefer, and then you control your symptoms with the one direction that you prefer. We started out that in the beginning. Now, the transverse abdominis. Transverse abdominis we talked about is this girdle-like wrapping around muscle. The way for you to palpate it or feel that muscle work is right off the pelvic bone. You're going to find your pelvic bone here, your hip bone. It's pretty pointy. Just put your fingers in there just to the inside of that. And if you pull your belly button into your spine or pull your belly button into your tailbone, that might be a better cue. You should feel tension, the muscle flex underneath your fingertips right there off the hip bone. Now, you want to be able to hold this for a minute, and you should be able to breathe. Your diaphragm is up here, that muscle is down here. So those are 2 different muscles. You should be able to breathe normally while you maintain that tension at all times underneath your finger. Oftentimes, patients that come in to see me with chronic back issues, they will suck in their belly really tight and hold their breath. And then that creates that tension that they want underneath their fingers. But that's an artificial just stoppage of the diaphragm from moving, creating this vacuum, which gives them the stability, but you cannot function without breathing, right? So you should be able to breathe normally while being able to turn this muscle on, all right? The transverse abdominis is one of the key muscles to stabilize the lower back and prevent any strain from going on those joints, and those muscles in the back can turn off, they can relax, all right? So once we got that transverse abdominis, we have that control, then we activate the glutes. The glutes are another way for us to stand, sit, walk, or pick things up without having that back muscle be more active. We want to take the pressure off of the lower back. So the glutes, from this position, we're just going to lift the hips up. I'm pushing with my heels to lift my hips up. And if I hold this position for a minute, I want to see or feel that the tension is here. Now, oftentimes people that have back issues, when they do this motion, they'll feel it in the thighs, or they'll feel it in the lower back, right? So our way to kind of decrease that faulty movement pattern where you're recruiting your thighs or your lower back muscles to do a hip motion is to focus on the exercise being pushing through the heels. And as you come up, you're going to push your knees forward. So as you push your knees forward to the wall, that brings my spine and makes everything long. I'm really separating my knees from my head, making nice and long lines here. And that gets the glute to turn on even more. If the glutes are weak, if you have poor strength, not just a motor control problem, you'll probably feel that in the hamstring, and then everything will cramp up. So you want to avoid that by maybe just staying here, putting your hands on your glute muscles, your butt muscles, and saying, all right, can I contract my butt muscle? That's it. If you can do that, building that brain to muscle connection, and then you see, all right, can I control one and not the other? It looks like nothing's happening, but I'm just basically palpating with my hands here, feeling, can I contract my left and then my right? Can I do left or right? Can I do individual? And then once I get that control, then I'm going to try the bridge again and see, hey, can I contract that muscle and not my lower back or my quads? All right. So I know that's a lot of stuff, but hopefully if you can see this on replay, and hopefully you found this all helpful.